Erectile dysfunction, condition that a lot of men suffer in their life at some point. There are many factors which can cause this. Some are physical and some psychological. If you're still having a morning erection, then it could be more of mental issue. Well, we are continuously talking about how to manage the situation. Taking pills with full of side effects is not always a good idea. This is just a temporary solution. So what if we can fix it permanently? Firstly, we have to understand the mechanism of erection. First, one of the most important molecule involved in erectile dysfunction is nitric oxide. Most of the medicines that we use work to increase nitric oxide. So why this is important? And what is the function of nitric oxide in our body? Well, nitric oxide relaxes the muscle of heart and opens up blood vessels, which improve blood flow. It is not only beneficial for erectile dysfunction, but it is also helpful for a heart and overall body function. Nitric oxide also helps you make testosterone and also regulates stress, which is one of the common underlying cause of erectile dysfunction. There are two systems working together in a body. One is sympathetic system, and the other one is parasympathetic system for healthy erection. Your parasympathetic system should be activated. But when you stress, your sympathetic system primarily dominate in the beginning. We spoke about erection in the morning. When you're in sleep, the stress level is low and your parasympathetic system is dominated. So if you're suffering from erectile dysfunction and you have normal erection, then the problem could be the stress. If you could reduce the stress, the problem of erection automatically resolve. Also, sleeping problem like sleep apnea increases your risk of erectile dysfunction. Diabetic patients are more prone to erectile dysfunction. This is because of the destruction of endothelial cells present inside your blood vessels. These end cells are the main source of nitric oxide in your body. On the other hand, nitric oxide increases insulin sensitivity, which is essential to control ED. Also, remember some lipid-lowering drugs like statin and fibrates can also cause dysfunction. Nitric oxide is the main key. If we can increase nitric oxide level in a body, it will solve the erection-related problem. Significantly, normally nitric oxide reduces by 50% after 40s. So is there any way to boost nitric oxide in a body? The answer is yes. First thing you should do is practice nasal breathing is produced in sinuses and is continuously into the nasal airways of humans. When we breathe through our nose, nitric oxide reaches the lung and circulates all over the body. The next thing you should do is regular exercise. There is several benefits of exercise. It helps to reduce our stress, which is very important to read erectile dysfunction. It can also improve your vascular system, endothelial cells, and increase nitric oxide secretion. So exercise is the key factor. High nitrates foods are a great addition to diet. You can supplements like L-citrulline, which increase blood flow. And 100 grams of fresh spinach contains anywhere from 24 to 380 grams of nitrate. This amount varies depending on growing conditions, and also cabbage family bok choy is the highest in nitrates, depending on its growing condition, and contain anywhere from 103 to 309 mg of nitrates per 100 gram. Next, lettuce is always known for being rich in nutrients. It contains a significant amount of natural nitrate. It has 13 to 267 mg of nitrates per 100 grams. Then beetroots also work really good, which your body can convert to nitric oxide. According to one study, consuming beets juice increased nitric oxide levels by 21% just after 45 minutes. Next, carrots. If you're looking for slightly or alternative, carrots contain anywhere from 92 to 190, 5 mg of 93 gram. Also consider dark chocolate, our citrus fruit, pomegranate nut seeds, and watermelon. Next thing is to avoid sugar, alcohol, and stress. Sugar increases the chances of having a clots in blood vessels and damage the lining of a blood vessels, lowers the amount of nitric oxide in a body, and we have discussed about the stress and how it affects somebody. Now the next thing you should improve is your sleep. A good sleep can reduce stress and improve erection. Also important point, you should remember that many drugs can cause temporary erection problem. So talk to your doctor. If you're taking any medicine and experiencing any recent changes in your direction, hope you find this video informative. Don't forget to like, share, and subscribe.